So I'm going to draw an analogy, and you tell me if it's a bad analogy. So in the anticoagulant space, we had warfarin was the standard of care for many, many, many years. And one of the unfortunate things for patients is that they would need to come in and have labs. But one of the side benefits to that is oftentimes in anticoagulation clinics, because you were coming in, you had frequent contact with the patient, and you were looking at other things, and you were able to maintain continuity and follow-up with them. Is that sort of the same thing in the oral oncologic space, where now that you got these new agents that you're sort of releasing the patient, that you come up with these services for frequent follow-up, and you have to provide them with these extra supports because you're not in front of them as often?
Yeah, and what you're describing and paraphrasing is exactly the medically integrated dispensing service. That's something that we all embrace at our practices and as an organization. Is what you just paraphrased is exactly the medically integrated pharmacy care team model that we like to refer to, where it's the right people, processes, and policies that are in place, where you have to leverage all of your internal resources to take care of that patient the same way you would for an IV, you're doing it for an oral. So you're leveraging the EMR, you're leveraging all the healthcare providers, whether it's the physician to the advanced practice, to the pharmacist, to the financial assistant that is investigating all the copay assistance that can provide that patient, to the pharmacy tech. It's that whole team approach. I think somebody here mentioned the multidisciplinary team. Same model, but on the oral side.
So interesting. What you're describing to me, so medically integrated dispensing service, is this idea where not only do you need to procure the product, not only do you need to provide the product or provision the product, but then there's all of these services that are typically more frequent on the floors or in the specialty clinic, where you've got these wraparound supports, patient healthcare services, medication support services, but maybe you act as an interesting bridge for the whole profession, because what you're saying is we've been in a world where we've had to have this traditional clinical practice with an EMR and labs and follow-up, and what's happened is manufacturers have innovated so that now becomes sort of this outpatient activity, outpatient pharmacy activity, but we're going to bring all of this stuff that we've done as far as clinical practice now to this outpatient kind of a circumstance. Fascinating sort of, feels like a Trojan horse a little bit to me for somebody that works in a community pharmacy, but that's really what you're trying to accomplish is, hey, we had them here, and we're providing all these extra supports, very necessarily and for all good reasons, but now we're going to figure out how to extend that beyond the four walls of this practice.
Yep.
Medically integrated dispensing service.
Because Troy, let me expand on that, also tell you what's currently happening where you don't have this medically integrated model. You are sending off a prescription, a large payer is mandating you to send off a prescription to a mail order pharmacy outside of your institution, right? So then at that point where you have sent off that prescription, there's a disconnect there immediately. You are no longer in control of that prescription. That large mail order pharmacy will then begin processing that prescription. Their ability to reach the patient, whether they have correct contact information for the patient or not, if all the prior authorization paperwork has been completed or not, if they communicate that with the clinic in a timely manner or not, when they actually mail out the prescription to the patient, all these are things that are going to affect adherence, are going to affect initiation of therapy, are going to affect the overall outcomes for the patient. So with this medically integrated model, where you're able to have the provider communicate to the clinical pharmacist who might be running the oral chemotherapy program, where an in-house pharmacy is able to dispense the medication, everyone is able to access the electronic medical record, everyone is able to access the patient's lab values to make sure that there are no pertinent issues that need to be addressed, there are no drug-drug interactions that need to be addressed or avoided or adjustments. So it's really an ideal model to provide that optimal care for the patient.
So that sounds like a medically disintegrated model if you're breaking that. So if the whole idea is we used to take care of direct observation, right? And now with these new therapies, we're going to extend beyond the four walls of the practice and provide these medication use supports beyond the practice. If that gets cut off, it's not medically integrated, it's medically disintegrated, frankly. And so you're a physician's assistant that, again, works in the exam room, has responsibilities there, but also in this medically integrated dispensing service. Tell me about circumstances where you have patients that are disintegrated. What does that look like then?
It can become a big mess.
Okay, what kinds of messes
So,
occur? I'm that patient,
have
now I'm
had-
medically disintegrated.
so-
What am I going to worry about?
Patient received medication before they were supposed to start.
Okay, sure,
There
I can
was
see that.
miscommunication.
Same day
They
delivery,
set-
right?
Yeah, they set up a delivery. We told them, don't start until you have your teach class. But because we worked out, the specialty pharmacy, or the mail order pharmacy took a prior auth and filled a script off of that, delivered that prescription to the home. Patient was to come in for education class and get their labs that day to start, but started ahead of time because they're anxious, they're scared. They have this diagnosis, metastatic breast cancer, they want to start their
Right.
medication. They started. They come in a week later for their teach class. Oh, I already started. Check the labs. They're all off.
So you've
Those
ruined your
things
baseline and your
Yes.
treatment plan. So what you're saying is the U.S. Postal Service doesn't come with a care plan?
Unfortunately.
No? Okay, all right.